everyone. Dr. Cary Yurkiw here. Thanks for joining me for this podcast episode for the missing semester. And this is a webinar we have coming up in September on the 12th at 8 a.m. Pacific, 11 a.m. Eastern. And I've been posting social media posts. I've been doing blog articles about this. We're currently writing a book as well, a booklet that's going to go with the webinar. So this content is very live and active and fresh, and I'm getting some questions here. So I'm just going to read the questions and provide some answers. And so the first one is, I'm 6 months out. Should I take the locum work or hold on for an associate position? I think if you're a new graduate, taking the locum work's a good idea because you learn a lot. You do get paid at the end of your locum, and I like to do my own locum contracts. I've done them in the past. Currently, I still help my colleagues out and do locums. I always have a locum contract that they sign, and then right after I invoice them, and I use the same method, and it's very effective, very good business. So you should have a locum contract. I would take the locum and get some experience and pay off some debt or have some cash flow. It's always really good versus trying to build the practice. You can still do that. You can still start building your practice and take locums too. That's a possibility. But the locums are really great, and I did that for the first 3 years of my career, and it was very valuable. Over 50 locums, 50 clinics that I worked at in that period of time. What should I be looking for in an associate agreement? I have one in front of me right now. I think first thing is you should contact a lawyer. I'm not a lawyer. I'm a healthcare provider with 31 years of experience. But it depends on the laws in your area. I think you got to be careful of the restrictive covenants. Like if things don't work out, what happens to your patient files? What happens to your scheduling, the bookkeeping that you had? So basically, you want that ability to take that with you. And you don't want to be restricted practicing in a certain area. Like if you like your area, you don't want to be restricted, like you can't practice within a certain number of miles or kilometers from that area. So I think, that's important. Talking to a lawyer about that, making sure you understand the restrictions. The other thing is how you're classified as an employee or a contractor, because that'll change your tax and tax implications, even your insurance. So those are important things to know. The notice period in both directions. So if you don't like the arrangement, then what is the notice period, or vice versa? And if it wasn't written down, a lot of it's hearsay. I would ask and record your meetings when you're getting interviewed. A lot of times they're being recorded anyway, but record your interviews, make notes from them, make sure that those terms are in your contract, use AI to help you, and then use a professional like a lawyer or accountant for you. And that leads into the next question, which is, should I incorporate? And I think you should talk to an accountant about that. I'm not an accountant, but I know when you first start out, there may not be a need to incorporate as your income grows. When you get to a certain level, it could be 100,000 or 150,000 of net income. Then it might be time to incorporate, because what the incorporation does is it kind of defers income for you. It shelters your income, defers your income. You can take money out of the corporation and pay yourself, and then you get, that would be personal income then. But the corporate tax rate could be different. It depends on your area too. I know where I live, the corporate tax rate's a lot lower. But then there's limits as far as what you can do with the corporate money. So understanding that and talking to an accountant's a good idea, and what your future plans are, what you want to do with your career. And then you've got another set of books to do, another tax return for a corporation. So that's something to think about. The fourth question is, when do I hire my first staff member, and who should it be? I think the first thing is you need to identify what you can do yourself. At the beginning, you could probably do most things, but as you start to get busier, anything that you can delegate. So, you know, if you're seeing patients, the doctor being the doctor or therapist, that's what you're trained for. That's what you should be doing most, if not all the time. The rest of the tasks could be delegated if you train somebody to help you with your history taking or assessments or your bookkeeping, your scheduling, your uh, returning messages. All of those things are very important. So they can be delegated as well. And so I think you want to delegate as much as possible to free you up so that you can do what you do best. And who should it be? I think, you know, you need somebody who's skilled in that area. If you can get somebody who's worked in another clinic before, sometimes that's beneficial. Um, but also just somebody who's strong in the areas where you need them. So be really clear with your job description, ask questions, and let people talk during the interviews. I do have a whole interview process that I can talk about another time. And then when you do hire that person, um, give them clear job description, procedural manual, or develop one so that if something does happen with that person down the road, it's very easy to hire someone else and then give them the procedures and continue on. This one's about social media. So question 5 is, my posts get good reach, but nobody books. What am I doing wrong? So if your posts are getting good reach, but nobody's booking, it could be that you're missing the call to action. Like at the end of this podcast, I'm going to say to you, you know, sign up for our free webinar, upgrade to the VIP, and stick around for the Q&A after the webinar. Join our mastermind group on these topics, and you can get some one-on-one coaching. So that's the call to action. And you could be providing good information on your social media posts, but you're not converting because there's no call to action. People are thinking, well, this person really knows what they're talking about, but they're not sure what to do next. So you have to direct them, you know, click on the link in the bio or the description below. So that's important. That call to action. Did I really get my ad account shut down? What happened is question 6. I did, and one of my assistants was posting on Facebook, which was going out on Instagram, and our posts were, our ads were doing really well. And then I asked her to split test one of our ads, so add a new video and some content. And I think what she did is she added a photo with the video. I think because I'm a chiropractor, the image looked like I was pushing somebody down, which is strange to say, but because the person was on the table and I was doing the adjustment, I think it violated a policy, but there's nobody to talk to at Meta about this. We've tried, and we can't reach out and talk to someone, and so our account that we had for 10 years got shut down, and there's no recourse on it. And it's unfortunate because it's affecting our ability to post using a scheduler as well, because we can't connect to those accounts. So it's a huge hassle. I can't find a way to start a new account. If you guys know how to start a new account on Facebook or Instagram, that would be great, or how to talk to somebody to recover the account. If they saw our post, they would understand that it's a chiropractic post and it's normal. But I guess their bots or whatever maybe thought it was something different and thought it was a policy violation. Question 7 is, I'm not a writer or a speaker. Is the book and webinar route really for someone like me? I love the books and webinars. I mean, that's why I do them. I love the writing process. I love sharing what I'm writing. A good way to share is the webinars. That content stays evergreen. I've even thought of starting some self-help type of courses from the webinar, like a little more detailed information. I like mastermind groups because it's efficient time-wise. So working together. And then I like the coaching too, one-on-one with my clients. But back to the book, even if you're not a writer, jot your thoughts down on paper. There are people who can help you with writing. AI is very good at expanding things now and being your editor. And speaking, you can just start like this, talking into a camera. That's pretty easy. You can edit out mistakes, and you can kind of progress, be a guest speaker. You can do it online. You could go and be a guest speaker in person too. So that's another option. So a lot of opportunities there for writing. It does increase your brand awareness. It does give you credibility as a health professional. Patients, when they come in the clinic and see that I've written books, it does bring you instant credibility. So that's a good idea too. So there's some answers to your questions. Again, if you're interested in joining me for our free webinar on September 12th, you can click on the link in the description. If you're here on social media, click on the link in the bio. And I look forward to seeing you guys at the webinar. If you want to stick around after the webinar and ask some direct questions, personal questions in a group format, then there's the VIP ticket. You can get one of those. It's around $49 US for that. And that'll be another half an hour after the webinar. So that'll be good information for you. If you want to join our group after the webinar, we do that on a monthly basis. You can join our mastermind group. And then if you want some personalized one-on-one coaching, feel free again to click on those links, and then you can go to the initial coaching consultation. I'll find out what your needs are, and if it's a good fit, then we'll start some sessions. Usually it's 13 sessions over 13 weeks. Sometimes it'll be 13 sessions over 26 weeks, and then we'll do a reassessment and just see how far we've come with the coaching. But you always do better with some help. So I would encourage you to get some help from a consultant or somebody who knows about your business and has kind of walked in your shoes. And I want to thank you for joining me today. Look forward to seeing you guys at the webinar and in one of our other services like the mastermind group or the one-on-one coaching services.